we considered in Ayurveda as Ahara as the best Bheshaja. Bheshaja means the medication. So the persons who is having that tendency to get skin irritations or psoriasis, they should avoid all kind of spicy items, masala items, oily item, bakery item, and then red meat and the food and vegetables which creating the problem worsens, that should be avoided. And during the winter season, most of the people will hesitate to go outside of the house, so they will be preferring indoor dry heat, which may once again aggravate the condition of psoriasis. If a parent, one of any parent is having psoriasis, the children will be having tendency to get psoriasis, and if both the parents are psoriatic, they will be sure the children will be getting the psoriasis problem. Namaste. Now winter season is going. So winter is the most coldest season of an year. It usually starts after the autumn and before the spring region. In many of the countries, even in India, we can see that during the winter season there will be lot of snow and the freezing temperatures. In Ayurveda, we consider this winter as the Hemanta Ritu, which usually starts from the middle of November and ends up with the middle of January. So during this season, most of the people, and especially not only the people, especially the human beings will be exposed to the less moisture and the freezing temperatures. So during this season, there will be tendency to get most of the skin problems are very common, and especially the dry skin are more prone. Human body is very sensitive to cold, and during this winter season, the core and surface body temperature is very difficult to maintain. Our skin is getting protected by the skin barrier, which is formed of the lipid and the dying or the dead cells. So during this winter season, the dryness will be getting more and the skin grows faster than the usual skin. So there will be lot of skin problem, dry skin, flaking, then lot of patches, all these things, and even very sensitive to touch may happen during the winter season. So when we are thinking about the skin problem, the first thing once we comes to our mind is the terrible term, the horrible term, the psoriasis. So many are very afraid of the term psoriasis, and nowadays even with this very minute dandruff, the people are getting worried. They will be going to the dermatologist and they will be inquiring that, doctor, whether it is psoriasis, and the main reason is the searching in the Google. So when they are searching in Google, lot of answers they will be getting. So even for the minute system, the people start worrying. And usually this psoriasis, it is a autoimmune, non-contagious and long-standing disease. Actually, this is a chronic disease, but there is no permanent cure for this. That should be there in our mind. So during this winter season, as already discussed, the skin, the lipid content will be very less and the skin grows very faster than the usual skin. So this creates lot of skin rashes in the body, which may appear red, purple, pink, and the lesions will be very itchy, dry, and lot of scaling may happen from the body. And it can be started from even a localized minute spots and to the complete coverage of the body. So what are the reasons for the psoriasis? Especially, as already discussed, is an autoimmune disease, and the genetic factor are the main culprit for this problem. For example, if a parent, one of any parent is having psoriasis, the children will be having tendency to get psoriasis, and if both the parents are psoriatic, they will be sure the children will be getting the psoriasis problem. So what are the other causes for the psoriasis reason other than the genetic factor? Environmental factors, usage of smoke or and exposed to the second-hand smoke, heavy alcoholism, any infections, any injury to the skin, then usage of some particular medication, and sudden withdrawal from the corticosteroids are the main reason for the psoriasis. So what are the symptoms? It is mainly the lesions, and especially it's mostly appeared on the elbows, knees, scalp, and even the trunk it will be appeared, and in other intense conditions it may appear all over the body also. And the lesions will be very small or even very big. It can be symmetric, asymmetric, and all the lesions will be very dry, and it started scaling. Even from the powdery discharge to the skin flaking can occur, and there will be itching will be there, burning sensation will be there, but only thing, it is not contagious. So there are usually 5 types of psoriasis are there: gut head psoriasis, plague psoriasis, pustular psoriasis, then inverse psoriasis, and erythrodermic psoriasis. So all these classifications are based on the presentation and the areas where it appears. So how can we diagnose? It's only mere the examination of the symptoms and the what the patient is telling, according to that only we can identify the psoriasis. So especially during this winter season, as there is very less humidity and very intense low temperature is there will be more tendency to get psoriasis will be there, and those who are already having the history of psoriasis, they will be having aggravation of the symptoms can occur. And another few reasons what we can observe in the winter season is, during the winter season the people will be very less exposure to the sunlight, especially the ultraviolet rays of the sun. So this ultraviolet radiations are a protective skin means that usually prevents the other mishappenings in the body, and the skin barrier also during which works during especially in the moisture content, because of the very low moisture content in the winter season, that also starts stopping, which may ease the entry of the toxins easy to the body. And during the winter season, most of the people will hesitate to go outside of the house, so they will be preferring indoor dry heat, which may once again aggravate the condition of psoriasis. And another thing, during the holidays, means winter is usually the holidays, so usually the stress levels will be more, because if you are going for the work, there will be work stress will be there, but if you are sitting in the house, another kind of stress will be there. So once again, stress is the aggravating factor for the psoriasis. And when they are get-togethering and all, the tendency to make smoking and alcoholism usage will be there, which once again increases the condition. And another thing, if the indoor gatherings are happen, many will be having many infections which we may not be knowing that condition what they are having. So those who have the tendency to get psoriasis, their immunity level will be very low. So if they are exposed to any such infections, the condition aggravate like anything during the winter. So the thing we should understand that those who are having tendency to psoriasis, the condition aggravates during the winter, and the person who is very normal is also having that tendency to get some or another kind of skin irritations will be more in the winter season. What we can do, as already discussed, it has no complete cure or no permanent cure, but temporary we can cure, because psoriasis is usually having the pattern that sometimes it aggravates like anything for few weeks or few months, and it subsides by its own. So through Ayurveda, we can make the subside episodes very easy and the recurring chances to get rid. Usually in Ayurveda, we considered this psoriasis as due to the vitiation or aggravation of Pitta and Rakta Dushti. Even the other doshas like Vata and Kapha will be also in the aggravated stage. So the medicines will be mostly aimed at the Pitta Shamana, Rakta Shodhana and balancing the other doshas. So initially the conditions like psoriasis, we start with Snehapana, that is the administration of some unctuous ghee or oil internally according to the condition of the patient. So as per the season, this ghee or oil can be administered either in the morning time or in the evening time, and it depends on the digestion, how the patient or the person who is showing, and the unctuousness which appears in the body, we fixed on the dosage of the ghee. So we cannot fix this many days we can do Snehapana, it depends from person to person. After completion of the Snehapana, we will just go to the Vamana, that means the emesis. So the medicines which suitable for their condition, we make them to eat and then make them to drink and then make them to vomit it. So after the Vamana, usually that Kapha will be eliminated and the doshas will be also in the somewhat normal stage, and following by Vamana, the Virechana, that is the purgation therapy. So depends on their digestion and condition of the disease, will be giving medicines which creates the purgation. At the end of this Snehapana, Vamana and Virechana, then we are advising the patient to undergo the Shirodhara treatment, that is especially with the medicated buttermilk called the Takradhara. So usually in Vaidyaratnam, we do this Takradhara only by the evening time, and usually we do the Takradhara from 7 to 14 days. And after the completion of Takradhara, usually a follow-up of Talam, means a medicated paste will be applying on the head. It can be done either in the form of Talam or Talapodichil, means if the scalp is totally affected, means the medicated paste will be covering all over the body. And along with that, other local treatments like Sarvangaleba, means application of the medicated paste all over the body, or Sarvangadhara, a medicated Kashayam or medicated buttermilk will be pouring all over the body of the patient, depends on the condition. Because usually after the completion of this Vamana, Virechana, Takradhara and all, the condition will be much better compared to the initial days. So according to the condition and according to the symptoms, will be starting the treatment. So after the completion of this main treatment course, the Artha Chikitsa, that is the Vasti Chikitsa, that also containing the medications which are Pitta Shamana, Tridosha Shamaka and Rakta Shodhaka, enemas will be giving. Apart from the Chikitsa, that is the Panchakarma Chikitsas, Shamana Aushadas, that is the internal medications, once again which are purifying the blood and which gives some moisture content in the body, will be administered internally. Along with the treatment, Aharas and Viharas, the another important part of Chikitsa. That is, we considered in Ayurveda as Ahara as the best Bheshaja. Bheshaja means the medication. So, the persons who is having that tendency to get skin irritations or psoriasis, they should avoid all kind of spicy items, masala items, oily item, bakery item and the red meat and the food and vegetables which creating the problem worsens, that should be avoided. Along with the food and all, usually those people who are having psoriasis, they will be having lot of stress. Means when they are having psoriasis, it makes them difficult to manage their day-to-day life, the sleep, the ability to concentrate, to mingle in the society, all will be hampered. So, these all kind of stress should be overcome through the practice of yoga, meditation, pranayama and all these things. So, in the winter season, we should be very careful that even if don't have the psoriasis tendency, we may get that problem of any other of skin irritations or psoriasis. So, we should be very careful and we should undergo the proper Panchakarma therapies according to the season. And if you are already having the problem, we should be very careful along with the Chikitsa, the Aharas and the yoga, meditation, all these things should be very careful. So, psoriasis is a problem, but if you are taking care, it will not be a problem. So, live a healthy life through Ayurveda. Thank you.